Sing of the Pambansang Awit ng Pilipinas, followed by a doxology by James Warren Ahero.
Bayang magiliw, perlas ng silangan, nananap ng puso, sa dibdib mo'y buhay. Lupang hinirang, duyag ka ng magiging, sa manlulupig, di ka pasisili. Sa dagat at bundok, sa simoy at sa langit mabaha, may nilagang tulad, awit sa paglayang minamahal. Pag-islap ng matawat mo'y tagumpay na nanininig, ang bituin na tara niya, kailan pa may magdidilim. Lupa ng harangan, bakit pagsinta mo'y langit sa piling mo? Aming ligaya na pamay mga pirang mamatay ng dahil sa'yo.
Bakit kaya? Bakit ka ba naghihintay? Nahimukin pa, pilitin ka ng tadhana. Alam mo na kung bakit nagkakaganyan. Lumulutang, nasasayang ang buhay mo, at ang ibinubulong ng iyong puso. Natutulog ba ang Diyos? Natutulog ba? At ikaw ay kaagad sumusuko. Kunting hirap at munting pagsubok lamang. Bakit ganyan? Nasaan ang iyong tapang? Naduduwag, nawawalan ng pag-asa, at iniisip na natutulog pa. Natutulog ba ang Diyos? Natutulog ba? Sikapin mo, pilitin mo, tibayan ang iyong puso. Tanging ikaw ang huhubog sa iyong bukas. Huwag mo sanang akalain natutulog pa ang Diyos. Ang buhay mo ay mayroong halaga sa Kanya.
Project Pro-CARI, providing clear and reliable information about healthcare in this time of the pandemic. Good day, everyone! It is with great pleasure to welcome you all to this 8-day webinar of Project Pro-CARI. I am Renchan Dos Armenta, today's webinar facilitator. Project Pro-CARI is an 8-day webinar starting March 6 up to April 24 every Saturday. In line with their civic welfare training service subject, the proponent came up with a said project to offer transparent and accurate healthcare information, to be able to clarify how harmful the lack of awareness in healthcare is, and for the community to apply as a good healthy individual. This is timely and relevant now that we are facing a global pandemic. With that being said, may the webinar series successfully provide information about healthcare. And now, our sixth webinar for today is from a statewide membership association of educators, adult students, and others who support equal educational opportunities for adults. Their mission is the advancement of adult basic education through increasing professionalism in the field and providing high quality basic educational services. Without any further delay, I am now handing it over to Massachusetts Coalition for Adult Education, together with Miss Sherry Reef, Master of Philosophy in Public Health.
The pandemic's impact has called for the need for increased health education and health literacy globally. Access to prevention and healthcare resources, understanding how to navigate health systems, and the ability to communicate healthcare needs are all important factors in health disease prevention. High-risk groups for disease have been identified in populations facing barriers due to limited language and literacy skills, limited income, age, ethnicity, and other social determinants of health. What role does education have in health and disease prevention? Why is this important in adult education? And how can health education and health literacy be incorporated in ABE and ESOL programs, classes, and advising? These are some of the topics that we'll be covering today to explore ideas for integrating health literacy and health education in adult education programs, advising, and classes. Next. So I'd like to start with this quote, and this is from the Ottawa Charter for Health Promotion. The Ottawa Charter for Health Promotion was the first global charter established in 1986 on the topic of health promotion. And basically what it says is that people, in order for us to attain our fullest health potential, need to be able to take control of those things which determine our health. Next. The Ottawa Charter for Health Promotion also established prerequisites for health, and that there are fundamental conditions and resources that are needed for health. And if you look, you'll see in this list that education is one of those fundamental conditions and resources for health. Improvement in health requires a secure foundation in all of these basic prerequisites. Now, the Ottawa Charter for Health Promotion also identified that health literacy within the category of education is also a key determinant for our health. Next. So what is exactly health literacy? Well, according to the World Health Organization, health literacy incorporates the achievement of knowledge and personal skills, the confidence to take action to improve your personal and community health, and the ability to change our lifestyles and living conditions. And it's much more than being able to just read pamphlets or make appointments, but really being able to improve our access to health information and our capacity to effectively use it. And health literacy has been identified by the World Health Organization as being critical to empowerment worldwide. Next. So who is actually at risk from limited health literacy? Well, it turns out that actually any of us could be affected by limited health literacy. Even though globally, nations, and including our own United States government, has tried to create awareness and increase health literacy, approximately 90 million adults have been identified as having limited health literacy. So who's actually affected most by limited health literacy? Well, it includes older adults, racial and ethnic minority populations, people of low socioeconomic status, recent immigrants, or other people whose first language is not English, and also the medically unserved. Next. One of our nation's leading leaders on healthcare, former Surgeon General Dr. Richard Carmona, stated that the health literacy in America is in a poor state. It's in a crisis. And he predicted that if we don't do something about this, that preventable disease could become a crisis. Next. And so we see that with the COVID-19 and the current pandemic that we're in, that we have some of the highest risk rates for COVID-19 in the same groupings with the highest risk groups for limited literacy. And this is a chart, one of the most recent charts from the CDC on hospitalization and death rates for the aged. And when you look at this chart, you'll see that both for hospitalization and death, the numbers go up starting with age 30 and on up. Starting with age 50, it becomes much higher. And then there's a huge jump in death rates for those 65 and older. Next. Next slide. The CDC has also identified that with COVID-19, there's also an increased risk for certain racial and ethnic groups. And these are also groups that have the highest risk for limited health literacy. And looking at this chart, again, this is one of the most recent charts from CDC. We can see that the American Indians, Alaska Natives, Asians, Blacks, and also Latinos have had the highest cases, hospitalization, and death rates for COVID-19. CDC has also identified, and this is, I should state that not just CDC, but actually the World Health Organization has also identified that race and ethnicity are risk markers for underlying conditions that impact health. And we're going to see in a minute that those include socioeconomic status, access to employment, increased exposure to virus due to occupations, especially those people that are working in frontline, essential, and critical infrastructure workers. And typically what's happened with the pandemic is that the groups that you're seeing in this chart are those that actually are working in those frontline and essential and critical infrastructure jobs. Next chart. There's growing evidence that due to health and social inequities, and these are long-term health and social inequities, some ethnic and racial populations are being disproportionately affected by COVID-19. And this is due to inequities in social determinants of health. Next slide. So what exactly are social determinants of health? Well, looking at this, we can see that there's a wide range of factors that determine our health, and these are just some of them. Social determinants of health are conditions in which we're born, grow, work, and age. And there's a wider set of forces that and systems that shape the conditions of our daily life and affect our health. What I'd like you to note is that education is one of those social determinants of health. And you see right at the top that literacy has been identified as being an important social determinant of health. Next slide. social determinants of health have been identified as being 6 times greater, having a 6 times greater impact on our health compared to clinical care. But in order to address social determinants of health, requires collaboration. It requires collaboration between health services and other sectors of society. Next. So health literacy has been determined as a key determinant of health. And it turns out that literacy is actually a stronger predictor of a person's health status than actually income, employment, education level, and racial or ethnic group. Next. People with low health literacy actually have a higher rate of emergency rooms visits, hospital stays. They're less likely to follow treatment plans, and they actually have higher death rates as a result of disease. Next. So why is health literacy important? Well, it helps people to be able to make decisions, to understand choices and consequences, processes and information that's useful, to be able to talk with healthcare providers and share their health histories and describe their needs and communicate what their concerns are, and to be able to understand treatment preferences, and to be able to find information and services. Next. Health literacy skills include a variety of things, and with health literacy skills, these are necessary to understand both the risks and benefits of medical treatment, to be able to understand diagnoses, to be able to navigate through the healthcare system, and to be able to also understand medical terms and biology. The application of health literacy skills also requires a variety of other skills, for example, computer skills, numerical skills, the ability to make decisions, the ability to use computers, especially at this time, and to have verbal communication skills. Next. So the World Health Organization, along with other countries, including the United States, every 10 years gets together and establishes worldwide objectives and goals for health improvement. And within the United States, we have what's called Healthy People, which establishes our national objectives for health improvement. And so this next level is for 2030. And as it turns out, attaining health literacy to improve the health and well-being of all has actually been established as one of its overarching goals. Next. Healthy People 2030 has defined health literacy in 2 ways: in personal health literacy and organizational health literacy. And both of these together, combined, are what Healthy People 2030 considers health literacy. So there's the individual's health literacy, and then there's also the organizational health literacy. And what you will be seeing over the next 10 years is that there's also going to be a focus on whether organizations are really focusing on health literacy and what measures are going to be established for determining that. So let's go to the next slide. Next. So this is a slide that shows the interactive framework for health literacy. And you can see that health literacy actually is very much dependent on a number of things, skills and abilities and demands and complexities. And for example, a complexity could be really the context of health literacy. And so health literacy is flows and webs. There's lots of complexity to what health literacy actually is and how it's actually defined. Next. There's major stakeholders involved in health literacy, and you can see right at the top that adult educators and literacy practitioners are considered one of the major stakeholders involved in health literacy by the World Health Organization. Now, in order for health literacy to actually be in place and for us to be able to improve health literacy around the globe, all of these different groups are needed to collaborate. Next slide. So educational interventions play a central role in promoting and strengthening health literacy. Next. And here we have a slide that shows that educational systems, schools, have a great influence in strengthening health literacy. If you have what's called a health promoting school, and that would be one that has within it a curriculum that teaches and focuses on health education, including health literacy, and within that program also it has partnerships and services, and there's programming within the school environment and other organizations. That actually has a great influence on strengthening health literacy and improving health literacy and health education and learning. At the same time, that flows into, when you look at the ecological perspective, it flows into our populations, communities, organizations, social networks, and individuals. Next. So with so much information on health now and disease and prevention, there's so many messages that we're all getting about what to watch out for, what you should do, what you shouldn't do, what you must do. What if you don't do any of these things, what will happen, what could happen to you? And there's so many choices to be made. Sometimes it feels like there might be too much information, and sometimes people ask, well, what does this all mean? And this can be very confusing, especially if you don't have the either language skills or the literacy skills to be able to comprehend all this. Next. So people need information that they can understand and use to make the best decisions for their health. And that's true for all of us. Next. And people need literacy and numeracy skills. They also need technology skills to find and understand and use health information and health services. Next. Health literacy incorporates a range of abilities, and these include information, decoding, weighing decisions, with the ultimate goal to be able to make informed health-related decisions and to be able to take action. Next. So here we're going to incorporate health literacy in a class lesson plans. Here's some ideas on some that you could be thinking about or ways to incorporate it. First of all, it's imperative to consider the needs of the students and families if your program or your class is including families, and also to relate the lesson plans to real life situations. Of course, lessons are better when they're interactive, but the lessons on health literacy and health education can certainly be inter and intradisciplinary. And then finally, to be thinking about what kinds of resources may students and or their families need on health, social services, or emergencies, and to be able to provide that information. And also with these resources, these could also be ways for a teacher to be able to utilize some of these resources in the classroom for lesson plans. And here's just a listing of some activity ideas. So these are some ideas that I've actually used when I've been teaching, involving health literacy, health education, and navigating healthcare systems. Role plays, discussions, projects, presentations. There's lots of things that you can do to make your classes relate to real life situations and make them interactive. And by the way, all of these ideas can be utilized not just within health education classes or classes focused on health, but these also can be utilized for other classes talking about incorporating health in history, in economics, in math, in science, in social studies, in so many different ways. Health is important to us, and it makes it more, the impact of the lessons on health literacy and health education when your students are hearing these messages and being able to receive this information in different ways. Next. So what about incorporating health literacy overall and developing a school-wide plan? Well, really looking at advising services and classes and school-wide programs. One of the important things would really be to start with a needs assessment and what are the needs of the students, the educators, the advisors, and also school-wide programs. And taking a look at training needs, and if people feel that they don't have enough background or experience to teach on topics of health, maybe there's some training opportunities that could be either brought into the school or resources that workers could be provided so that they could get the training that they need. Also, to take a look at what types of resources are needed within the school for educators and advisors, and also any kinds of other additional needs that might, there might be some gaps and other help that's needed. Also really important is to really collaborate and talk about what types of challenges and barriers are happening in the school or that either teachers or advisors are feeling or possibly within the school environment. And then also, of course, looking at opportunities. There's a great opportunities in developing health literacy and health education and integrating that in within educational programs. And then to be able to prioritize and creating an overall plan, looking at not just classes, but advising plans, and then maybe collaborations that you could have with the community or outside organizations. And then, of course, implementing and then doing an evaluation. And of course, always thinking about updating these plans because there's always things that we learn once we implement. So all of this really creates an opportunity for collaboration. And with that we're going to be, in a couple of minutes, having the opportunity to discuss all of these ideas. You can go to the next slide. And I also wanted to just let all of you know that if you would like any additional information, I'm very happy to be in touch with any of you. Feel free to send me an email at the very bottom there. My email is healthlanguageandlearning@gmail.com. And if you have any additional ideas that you would like to share, I'd be happy to hear from you.
Thank you so much, Miss Sharif. Truly, MCAE is true to its words, providing knowledge and the advancements of adults through high-quality educational services. With this webinar on health literacy, adults will be able to suffice their lack of knowledge in relation to healthcare. Thank you so much to those who participated in the sixth part of Project Pro-CARI webinar series. The page is open for questions until 11 in the morning. Again, thank you and see you on the seventh part of the webinar next week.